While COVID-19 has left several hundred hospitalized in the tri-state, the medical cost is impacting many more, whether they had the virus or not. As our community recovers from the financial fallout of this pandemic, we're here to help with what we're calling the rebound. WCPO 9 News reporter Lisa Smith found that there is some confusion over what bills the government will cover and what bills you'll have to pay.
When you're rushed to the hospital with a high fever, shortness of breath, and other COVID-19 symptoms, the last thing you should be thinking about is the bill.
When you're ill or in an emergency situation, you're not thinking about whether that person's in my network or not. You want to get the best help.
Craig Antico is one of the founders of the national nonprofit RIP Medical Debt. They pay off lingering medical bills for people who can't afford to pay them. Earlier this year, they worked with Crossroads Church to pay off thousands of dollars in medical debt.
We pay the market rate for debt, which is kind of funny in that people don't realize that their debt is worth a lot less than the full value.
The Federal CARES Act included over $100 billion to reimburse healthcare providers for testing and treatment of patients with COVID-19, but that only included those who were uninsured. Some health insurance companies plan to cover deductibles or copays, but not all. Then Antico says there could be another problem for patients.
And then there's these issues that say, well, we don't think you have COVID. We don't think you had COVID.
At Cincinnati Children's Hospital, they're seeing a 350% increase in requests from families needing help paying medical bills.
If they're underinsured and they find themselves with high out-of-pockets or things they can't pay from chronic children's needs, then we're here to help.
Children's and other hospitals in town have a charitable care fund for times like now.
We've had lots of crying families where they've lost jobs, or because they've lost the job, then they've lost their insurance.
Meanwhile, Antico offers a number of tips for families worried about medical debt. First, call the billing department to try to negotiate a lower bill. Ask for an itemized bill to double check the charges, and try not to pay more than 3% of your income per month.
You're putting yourself in harm's way and you're hurting your family if you don't go by that rule. So if you make $1,000, you can only pay $30 a month.
Lisa Smith, WCPO 9 News.
Find more tips in Lisa's story on COVID-19 medical bills in the rebound section of our website. You know it's WCPO.com.